So my name is Regina Barragan-Carillo. I am a medical oncologist and a postdoctoral fellow here at Cedar Comprehensive Cancer Center in Duarte, California. And I'll be presenting our poster titled Impact of Latino Ethnicity on the Gut Microbiome Composition in Patients with Metastatic Renal Cell Carcinoma. So historic data has pointed out that Latino patients with metastatic renal cell carcinoma have worse outcomes when treated with frontline immune checkpoint inhibition when comparing with their non-Latino counterparts. Furthermore, enough evidence has pointed out the fact that the composition of the gut microbiome could impact clinical outcomes with immune checkpoint inhibitors. We have observed that in melanoma, in lung, and also in renal cell carcinoma. So what we aimed was to determine whether the Latino ethnicity could impact on the gut microbiome composition between patients. So we prospectively collected stool samples from patients, and we analyzed them with whole metagenome sequencing. NCAMBC analysis was used to determine whether there were any specific differences on bacterial species between the two groups. We ended up collecting samples from 59 patients. Among these, 27 were Latino and 32 were non-Latino. We did not observe any differences in the clinical characteristics between the two groups. The median age was 65 years old, most had clear cell histology, and also most had intermediate and per-risk disease. When looking at the composition of the gut microbiome, we observed that in Latino patients, there were 14 bacterial species who were enriched and 3 who were depleted. Among the 14 species which were increased, we noticed an increase in the Roseburia species as well as an increase in the Eubacterium rectale species. All these have been previously linked to better outcomes with immune checkpoint inhibition. As for the non-Latino patients, we did not see an enrichment of such species, and the one which was more common in the non-Latino group was part of the Methylobacterium species, which itself could be impacting patients' outcomes in a negative way. So we concluded that indeed there were differences in the bacterial composition between the Latino and non-Latino patients. So we consider that further investigations are needed to determine the clinical effect that these differences may have for patients.